from 2020 to the end of 2024. The number of practitioners in China's health sector has grown by 17%. As of 2025, as China's second-largest occupational group, the number of health and medical practitioners has reached 15.78 million, with the total number of licensed physicians and assistant physicians exceeding 5 million. Oxygen saturation, 98%. Heart rate, 112 beats per minute. 8 a.m. Dr. Hu Kai, director of Lymphoma and Myeloma Department, begins his day. Shift handover, case reviews, ward rounds, adjusting treatment plans. Compared to his race against time, waiting is the main theme for every cancer patient. Waiting for tight bed space, etc. Waiting for lab results. Waiting for new drug approvals. Anxious, yet also waiting for the hoped-for future. As a pioneer of the research hospital model in China, Gaobo Medical Group currently operates in Beijing, Shanghai, and Guangzhou, running 7 hospitals focusing on solid tumors, hematological diseases, and active innovation areas like brain science. Today we visit 2 of Gaobo's hospitals in Beijing. Usually there are no bustling outpatient clinics here, nor many anxious family members. What kind of people are busy working here? Okay then, let's get discharged for now. Okay, I want to go home first. Okay, this plan shouldn't be too bad either. I can just go home and recover. Take the medicine yourself at home. That's it, they are all oral medications, right? Ah, you must take care of yourself. Okay, well, do the replenishment today. Yeah. How is it? Have you regained some strength for walking these past 2 days? Recovered a bit more? In this department, most of our patients have hematological malignancies. We are probably facing patients' kind of life and death issues in a department like this. The last room over here is for recording medical records first, and then the director will see the light. I personally still really like practicing medicine. Sometimes I chat with them. I say I feel treating patients is like students solving problems. It's addictive. Each patient who comes is like a problem for you to solve. I went back and discussed it with my father and sister yesterday. The elderly parent is very resistant to chemotherapy now. He'll try to reduce the dosage for you as much as possible. Doesn't he just feel fatigued and such? Yes, but you can even use 200 milligrams. How much does he weigh now? 82 Gen. Very thin. Look at the stent where the plastic tube was placed. It's not very useful, not very useful. Yes, not very useful. Borrow this pathology slide. Yes, bring it here, and I'll do a consultation, and take a look. First, we also need to give the patient confidence. We probably need to quickly within 24 hours. First, sort out the patient's entire long-term multi-year treatment plan. And also for each of his relapses perform an analysis of the causes. You say give him confidence, and let him see hope. Then you have to do the work properly. Only then can confidence be gradually built. Once this course of treatment is finished, and the evaluation is done, we can directly adjust the medical orders. Okay, thank you, director. No problem, no problem. As long as the remission is good, right? Okay, thank you, then no problem. Many children spend their birthdays in the ward. The hospital also organizes a birthday party for the children in the ward every 2 months to make the children happier here. These 2 were pasted by a little girl in our ward yesterday. Things like these are probably gifts of love from quite some time ago. Hello. Here there are chief physicians who have practiced for over 20 years, as well as those carrying ideals, and enterprising young doctors. What is the reason that made them make the same decision? We were doing a biliary tract surgery, which required a special guide wire. After applying just after 1, this guide wire was already being used in our operating room. Here at Gaobo Hospital, They can provide me with support for consumables and new technologies, giving them the best conditions I can provide. Say no more, yeah. You don't need to do anything. You just manage it. Private hospitals are thirsting for talent. All right, just say. Gaobo indeed provided me with a very good platform. This machine is the magnetic wave knife. Nationwide, there might not be more than 10 of them. And in Beijing, there might only be 3 or 4 like this. Yeah, and Gaobo has one right here. Go ahead and say it. Everyone here has really been exposed to a lot of this, including equipment. Treatments, they are really new. And I am really also learning. Constantly broadening my own horizons. Yeah. And another thing. Its CK is high. Is that related to the one just now? Yeah. It's been placed for 7 days now. It'll draw out the water first. Yes, this year. We have taken on quite a number of such clinical projects. So the overall start and development are very fast. Here, collaborating with them. Within this 1 year, you might complete a path that others couldn't walk in 5 or 6 years. Their white blood cells are still over 6,000, but neutrophils are not high. Neutrophils are only 1.23. The laboratory here is extremely comprehensive and very authoritative. For example, after he comes on Monday, we will perform a puncture for him. The next morning, we can call to ask for a preliminary result. Once you have a preliminary result, you have a preliminary direction for treatment. As for Gaobo, they encourage young people, encourage young doctors to explore and innovate more actively. Now, to publish papers and step onto the international stage. I have also spoken at international conferences. I think this is already a very important experience in life. Whether it's for my medical career experience or my own mental growth, it is all a kind of elevation. Let's see if it can come out this week. Okay, then we still need to see you, which is different from typical enterprises. Here doctors as employees seem to have more choices relative to their employers. Choosing to take every surgery seriously, choosing a more complete testing environment, choosing to discard tedious processes, choosing a promising future. Under today's healthcare system, how Gaobo defines its own value is an intriguing question. Patients with relapsed and refractory diseases precisely need long cycle treatment and need to occupy bed resources for a long time. We happen to provide this differentiated choice, providing these relapsed and refractory patients with a larger space to complete their treatment. Gaobo is like this. It is not purely a hospital. It has its own clinical trial management team. It has its own statistics and database team members. So here, relatively speaking, as long as you have ideas, as long as you have needs, I can mention it to the hospital. It has different team members like this to help you. Mainly, from the current perspective, overall the types of diseases of the patients admitted in these 8 years are mostly relapsed and refractory, heavily treated cases where current treatments failed, and they have basically undergone various treatments in other hospitals before finally choosing Boren Hospital. In terms of the treatment methods for pediatric lymphoma, our 5-year disease-free survival rate is at least over 80%, so its long-term recurrence rate is also significantly reduced. How does Gaobo define its value? Perhaps the people working here and the patients receiving treatment are the most comprehensive and sincere answers to this question. Hey, hello. How is the child doing? Not bad, right? It doesn't hurt, it's much better now. Now he can lie flat. At least, yeah, much better than before, right? At least now you have a smile on your face. When you first came, you were in tears almost every day, right? Yes, it's okay. It's just a process, you know. It's already very small now. Really? Oh, that's wonderful. Very small. Oh, it's really the first time I'm so moved that I'm about to cry. All of us who come from this industry, you have a responsibility to make them live better with you. We want to pull them up from the cliff. In a sense, we are fighting against destiny. For a hospital to gain the recognition of society as a whole, I think that's not a matter of decades. It may take the efforts of several generations to establish such social influence. So, I think we should take this slowly. What can you eat now? Sweets are fine and rice. Tell me how to walk. Let me see your mouth. Oh, great job. The stories happening at Gaobo are providing a precise and clear interpretation of mutual achievement in employment relationships, and also opening a new window for cancer treatment. In the future, we will continue to explore other hospitals under Gaobo Healthcare Group, revealing more facets of Gaobo.